Dr. Harvinder Singh from Psychiatry Education Forum. Today I am super excited to announce our next educational series on the management of PTSD. Right from first line management to treatment resistant PTSD management. And this is our 2021 update for PTSD management. In this lecture series, we have most of the lectures given by Dr. David Author, and rest of the lectures are given by me to complete this educational series for you. So we have close to 15 chapters or topics that we will go over in this series, and it can be too much for anyone to watch in one day. So to make it more easy and give you more structure, we have divided this into 3 days. Each day we'll talk about 4 or 5 topics so that you can finish this more easily at your own pace. So before I go into our schedule, let me introduce our speakers. So Dr. David Author, he is the author of Psychopharmacology Algorithm Project at Harvard South Shore. As you know, he has published on PTSD management algorithm, but he will be giving us 2021 update, which is still under publication. So you will hear him talk about this first on our website. So one more thing I will say is, before I go into the schedule, that this is only for our Academy members, but I will talk about all that in the end as to how you can join us and get access to this and more of the features. So friends, let me go over our lecture schedule now. So for day 1, we will begin with a welcome message by me. And the first lecture is on comparing PTSD and complex PTSD in terms of how to diagnose them. And then we have Introduction to PTSD and Psychopharmacology Algorithm Project by Dr. David Author. And then Dr. Author will talk about first, managing PTSD with comorbidities, mainly the substance abuse, depression, bipolar disorder, psychosis, and management of PTSD during pregnancy. And from day 2 onwards, we will start our topic on insomnia and nightmares management with PTSD. So Dr. Author will talk about that. Before we delve into PTSD management, the first thing is sleep management. That should be our priority. But the topics on day 2 are sleep problems with PTSD assessment and management, prazosin for nightmares and awakenings, prazosin, how to dose and titrate for men and women, using terazosin and doxazosine. And what if insomnia is poor onset type and not nightmares or hyperarousal type? What management options we have then? And then we'll end the series on day 3 with a role of antidepressants for PTSD management, ranging from SSRI, SNRI, mirtazapine. I have not mentioned here, but also bupropion. And then we have PTSD-related psychosis management, and then treatment-resistant PTSD management. And then in the end, I will end this talk by talking about ciproheptadine and nabilon for PTSD management. So this is our lecture schedule. I think we have more than 10 to 14 lectures, I think. I have not counted them yet, but there are many chapters. That's why we have divided this into 3 days lecture schedule. But one thing I want to mention, friend, is that these all lectures will be available for our Academy members even past these days, because these are all recordings. So you can watch them later also. But with this 3-day schedule, I think this will give you structure to finish them very easily at your own pace over this 3-day period. Okay. So this was our schedule, friends. As I said, if you're interested in getting access to this educational series and many more features which are included within the Academy, please go to Psychiatry Education Forum and read about what this Academy has to offer. And then if you're interested, click the subscribe button. But again, if you have any questions about this recording or anything else that I can answer for you, please don't hesitate. Click on the contact us button above or send me an email at hsingh@psychiatryeducationforum.com. So thank you again, friends, for listening to me. You all take care and have a nice day. Bye for now.